Hello, everyone. My name is Garrett Wong. I'm the Member Services Manager here at the Green Sports Alliance. And on behalf of the entire Alliance team, we hope all of you are staying safe and healthy. And thank you all for taking the time to join us today. I know we're just a little after the hour mark, but happy to get this continued conversation going of our Ready to Play webinar series here in a ongoing fashion. This one titled Maximizing the Human Experience with Your Venue Re-Entry Plan. We want to thank LNS Captioning for providing today's closed captioning for the session. More information on how to use this service is included on the chat box onto the right-hand side. And I am going to make sure that I can get the presentation onto the appropriate screen. Does everybody see it now on the appropriate screen, or let's see if we can move a couple of pieces around. I'll get that up and running here shortly. Apologies for that, everybody. But during the webinar, we should be seeing our webinars and the slide deck on your screen. You should be able to toggle and resize those as necessary. Let's see if we can fix the presentation piece here. Apologies, everyone. Let's do, we can duplicate. How is that for everybody? Are we able to see the presentation now? Perfect. All right, everybody. So now that we've got things under control, sorry about that. We'll jump right into here with our first piece. So the webinar access for today, all of our recordings are going to be on our YouTube Green Sports Alliance page. The presentation slides and the recording of today's session will be emailed to all attendees at the conclusion of the webinar. And if anybody has any questions, feel free to contact us at info@greensportsalliance.org for more information. Our 2020 summit is going virtual this year as a result of the COVID-19 pandemic. More information on speakers, topic items, and registration will be available soon at greensportsalliance.org/summit. And for our sponsors, members, and partners, feel free to reach out to myself or the rest of the team with any questions. And we're excited to kick off our 10-year anniversary here in October on Tuesday and Wednesday, the 13th and 14th of October. And to save the date for our next session within this Ready to Play webinar series on measuring, understanding, and improving reentry and beyond, that will be on Wednesday, September 2nd at 10 a.m. Pacific, 1 p.m. Eastern. And those speakers will be announced here shortly, so feel free to keep an eye out for more information. And I want to welcome everybody to input all of your questions into the question box. Throughout today's webinar, we'll have a Q&A session allotted at the end of the session. And that will be when we are able to kind of dive into some of these different topic items and discussions here with all of our speakers. So feel free to send any questions or thoughts your way, and we'll do our best to get through them as many as we can. I just want to kick it off here. So the first speaker that we've got here today is Katrina Saucier. Katrina, the program manager with Green 2 Sustainable, and really excited to have her on our GSA working group for the first edition and version of our Ready to Play playbook. And maybe she'll be talking a little bit more on that here shortly. But Katrina, thank you so much for being here. I want to welcome you to pop up on video and to take things away here.
Great, thank you, Garrett. I think you should see me now. Awesome, well, let's go ahead to the next slide, please. What you see here is a quick agenda, just so you kind of know what you're getting yourselves into. But what I really want to do is outline the occupant experience, which is a section that's specifically within the GSA playbook that we put together, as well as highlight some key talking points around some takeaways that I think will be particularly helpful for this group as they're digesting through this extremely valuable playbook. And then lastly, I wanted to just close with some different technologies as well as strategies and things that you can do or experiment with on site And that will also lead into some of our other panelists as well. Next slide. So as most of you have seen, GSA has been working really hard with a very dynamic group of professionals to create a ready-to-play book for stadiums and sports venues specifically. At the foundation of that, it was taken in collaboration with ARC's program. And a key piece of that playbook is what we are calling occupant experience. And that's what we're going to be talking about today. And really, the whole point of the occupant experience is to understand if all the strategies that you and your team are instituting to create a safer place for employees, players, as well as fans, is in fact perceived by those individuals. And quite honestly, the best way to find out if that is in fact the truth is to ask. And the easiest way being a survey. And so this is really serving as the ground truth of how you're transitioning from your idea in theory to how it actually plays out in practice. And this really confirms expectations in terms of what you were hoping to achieve, as well as identify needs for management where you may need additional action. A key piece to this is obviously the survey. It's very short. It's 9 questions. It's web-based. It's built through ARC. Aaron and Cody will actually be talking about a direct link that you may be able to use to get it on fans and employees' phones, which will really help streamline that process. But the goal is to make it quick and easy to get a general understanding of how people are feeling in your facility. It talks about what they are actually observing when it comes to signage, screening, disinfection, and cleanliness, as well as accessibility to hand washing and hand sanitizer, as well as overall their sentiment while they're in the location. Next slide. And the ultimate goal of doing this, of getting your occupant feedback, is to create this iterative feedback loop. And one thing that's kind of advantageous for everybody, if you can see the silver lining, is that there really are 2 phases of occupants. The first phase are your employees, your vendors, and hopefully soon athletes. So these are the individuals who will be experiencing this newish environment first. And so you have an opportunity to have them go into your venue, see how they perceive the experience by then administering the survey via email, and then using that feedback to improve. Then, to make it an iterative feedback loop, you do the same thing with both your phase 1 and phase 2 occupants. Your phase 2 occupants being fans, event staff, and visitors. So these are really more a much larger group, as well as the tried and true tests. And so by iterating, you're able to test things on a smaller scale before it goes to a much bigger scale, which can be really helpful and provide a productive learning experience. Next. So I have this bird's eye view map of a floor plan of an ice hockey rink, just to give everybody an idea of how you can break this occupant experience up by different sections. So in the phase 1, we really identified 2 types that are considered private because it's not the general public. And this is first with your employees and maintenance staff who would be in office or in food prep locations or even in maintenance rooms. And so this is, as you see in this map, completely separate from all the other locations where you'll have to have similar initiatives. So then we also have our private access for athletes, again, completely separate from those other 2 groups, where it really looks at lockers and the sporting arena. And then we have the public access for visitors, which is what you see in yellow. And the key thing here, and what's really great about the survey, is that this type of the person who is taking the survey is identified. So when you send a survey to an employee, they get the private admin access. So you know they're commenting on the blue spaces. Whereas if you send it to an athlete, they're commenting on the purple spaces. So it really helps you understand how each of these different types are playing into each other. Next, please. And just some key considerations, some key takeaways as you're formulating your plan for understanding your re-entry process is first considering how things are scalable from phase 1 to phase 2. As you saw from that map, there isn't a lot of overlap, but it allows you to try to see what works, as well as adjust how does this change as we go from phase 1 to phase 2 entry. Then we've been hearing a lot about communication is key, especially before events, to all individuals, whether it's having your employees coming into the facility for the first time, which would be an event, or having your athletes come in for the first time. So they're able to see the information of how things are going to operate in the stadium before they even get there. Because quite honestly, during the event, it's kind of a bit of overload. There's so much going on. There's going to be lots of signage, lots of adjustments. And so communicating before, during, and after the event is definitely recommended, as well as even considering a pre-event survey, particularly for fans, to see if their willingness to comply aligns with your plans, and use it as a precursor to be a little more proactive on what your plan is rather than reactive, which is the survey after the fact. And then in terms of the communication, really leverage everything we have at our disposal. And I think leveraging technology as we reopen our facilities is really key to not only creating a safer space, but also a more environmentally friendly space, which is what we're all aiming for. And then also to be sure to have inclusive communication. So consider different languages, as well as consider individuals with different abilities, whether they may be visually impaired or illiterate, and also leverage different media types. And then, of course, always try to integrate sustainability with your planning. Next. So these are just some examples of some digital signage that you can include. It really is just about being really easy to understand, quick sound bites, and making people feel included. I know Juan is going to talk a lot about how communication and engagement and the way you do it is really key to get people engaged to participate. Next, please. You can just kind of go through these fairly fast, Garrett, because these are just different examples of the signage you can include to help people understand what you're actually doing, as well as include those quick and easy sound bites, so people understand those precautions, and hopefully lead to you having better survey results when you are getting those surveys back from other individuals. I think these signs are really important. As you see, they identify information directly published by the CDC, a very credible source. There's pictures involved, as well as text, and then you can equally do multiple languages. And I think that's just so important with sports in particular, because I find it just really is completely transcendent when you're talking about political background, ages. It doesn't matter. Everybody shows up for sports. And I think this can really make sure you apply to that. So thank you all for joining. And now I will pass it back over to Garrett.
Thank you so much, Katrina. This is a fantastic way of really outlining this phased approach of bringing folks, staff, team personnel, and fans back safely into our venues with a key emphasis on communication and transparency. And now really want to speak a little bit more on their solution for this communication and digital transparency. We have Aaron Short, the CEO of Beeline, joining us today. Aaron, if you wanted to jump off of mute and throw up your camera if you can, would love to have you jump in and talk to us a little bit more about Beeline and the solution that you guys bring.
Hey, Garrett, can you hear me?
Thanks for, yep, Aaron, thanks for joining us.
Okay, sorry, my camera is not working. I've tried multiple times, but
no worries.
I'm just gonna roll with it. Hopefully the picture will do. Good afternoon, everybody. My name is Aaron, and I'm the CEO of Beeline, and we're a faculty management and contact tracing platform. So we help organizations with preventing the spread of infectious disease. So we're going to keep this presentation as consultative as possible, as we know many of you are looking for solutions to assist with the reintegration of your organizations, and our offering is just one of many solutions needed to make reentry post-pandemic as seamless as possible. Garrett, can we go to the next slide? So as many of you know, COVID has drastically affected the safety of players and staff. So with incidents like the outbreak on the Miami Marlins, organizations are in need of solutions that help them to adjust to the new normal of simply not knowing when the spread of infectious disease will impact their organization. Kara, can we go to the next slide? So this is also applicable off the field, as staff are also afraid of returning to work due to the number of people that are asymptomatic and may not know if they are COVID positive until it's too late. Garrett, can we go to the next slide? So in the absence of not knowing, Beeline is providing critical insights on the health and well-being of your organization. And we're partnering with organizations like Arc Reentry and GSA Ready to Play to kind of help do that. Garrett, can we go to the next slide? Do you also mind hitting play? So for example, we provide information through occupant and faculty management surveys, as well as autonomous means to effectively manage your organization in real time, allowing players, staff, and fans to anonymously share if they've been diagnosed with an infectious disease and conduct predictive analytics on the potential impact that a COVID positive individual may have had on your organization over the last 14 days. We also do send notifications to help with occupant and faculty management surveys directly to users' phones before, during, and after events. Garrett, can we go to the next slide? So in addition to surveys, we also provide autonomous collection of critical information, including location services, mobility tracing, and mode choices to a building. As you can see here, all the information is critical to getting one step ahead of COVID and identifying all possible chains of transmission to and within a building. Garrett, can we go to the next slide? So like every app, getting user adoption is hard unless you have a catalyst for users to adopt it. So currently, contact tracing apps that have been released by national governments have had very poor adoption rates. And right now, the highest global adoption rate for a contact tracing application by any country is Australia, with just 21.6% of its population. So as you know, contact tracing applications are only effective if everyone does it. So the reason user adoption has been so low is simply because these apps only serve one function. So this is why Beeline has partnered with Zerv, an access controls company, to create a seamless contact tracing and contactless entry solution that integrates with the access controls of your building. So all members and visitors of your organizations are required to have a contact tracing solution in place before they can enter the premise of your building. So this helps to protect the health and safety of all members of your organization. So I'm going to pass this over to Cody Horjak, who's the CEO of Zerv, and he'll tell you a little bit more about that.
All right, mic check on my end. Aaron, you hear me?
Yep.
Okay,
Yep,
good.
all good.
All right, wonderful. Aaron, thanks for passing this over here. Garrett, if you wouldn't mind going to the next slide, just a quick recap. My name is Cody Horchak. I am the CEO of Zerv. Zerv is a hardware company, so we created a proprietary way to enable phones to communicate with legacy access systems as they exist today. We partner with companies like Beeline to provide value beyond just the survey and all the analytics that they provide that's highly critical in understanding the flow in your organization, to actually bridge the gap so now that application can communicate with the physical world, really contributing to that critical adoption. Contact tracing is only effective when 100% of the people are doing it. One person opting out could be the catalyst of that contact tracing becoming inefficient. So what we do is we provide our hardware to Beeline. Garrett, if you wouldn't mind going to the next slide. And our hardware provides critical information and bridging the gap between a mobile platform and the physical world. How it works is our proprietary technology acts as a translator between a modern phone of an iOS and Android device and the legacy physical access system you have in place. In this graphic you see here, these are legacy readers that your employees might present a badge to get into the office, readers that your players might present a badge to get into the facility. We can even go a step further and we can communicate directly from a mobile phone via Bluetooth to a ticket management or a ticket scanning system. So it's really just, you already have all the systems, you've paid all this money for them. It's just maybe not optimized to communicate with the phone, and that's what we enable. Garrett, go ahead to the next slide. And we do so without changing anything that you've already invested in. It's very much an overlay to make that system touchless. A side effect of our technology is actually making that physical contact world simplified. we're able to get data of understanding how many people have checked in and how many people have checked out, real-time capacity numbers, also go back and audit log the access credentials, the players, the fans, the employees, knowing where they were. So if there were to be an outbreak, we could focus in, see who they were in contact with, portion off those things all through an anonymous way or an automated way. Garrett, go ahead to the next slide for me. Thank you. An additional side effect of our technology is the ability to effectively monitor locations in a way that's never been done before. So now all your ticketing and access is behind Beeline, but more importantly, you're able to monitor specific locations. Next slide, please. For example, if we were to overlay our technology over a stadium, we could say, hey, the field is at 25% capacity, and that might be the threshold for the field. So we could actually automatically turn off everybody else's access in real time so nobody else can come onto the field until that threshold falls below the 25%. These are things technology can do. We're doing this with some of the largest retailers in the world, also some of the largest grocery chains, in numerous office buildings, owner operators, developers. We are really trying to get a step ahead or helping organizations get one step ahead of COVID, because regardless of what side you're on, what you feel about the coronavirus and politics as well, coronavirus is here to stay. Some of the best health professionals in the entire world are projecting that coronavirus is going to be similar to the flu. It's going to come and go every season, and it's all about how do we effectively manage it, keep our players, keep our employees, and keep our fans safe, but also maintain business. So what Zurv does through the power of Beeline, what Beeline does with the power of Zurv is we automate this process for you. Next slide, please. We know the end state is getting the players back in the stadium. We're all striving towards that. What Katarina was saying about, hey, phase 1 and phase 2. Phase 2, we're all striving towards that, but really what we're focusing on today and solving a problem and what we're helping all these massive organizations and companies achieve is just managing the day-to-day operations today and putting processes and technology in place to manage it tomorrow as well, 6 months from now, a year from now, when we can start bringing players or fans back into the stadium. So at this point, I'm going to turn it back over to Aaron to wrap it up. But thanks everyone for chiming in. Appreciate the time here.
Garrett, can you go to the next slide? Thanks for that, Cody. So this is kind of an overview of our end-to-end faculty management and contact tracing platform. If you think this is of value to your organization or want to hear more, we would be happy to jump on a call and showcase a few of our case studies and answer any questions you may have. So here's our contact information. Thanks for your time, and I'm going to pass this back to Garrett. Thank you very much.
Perfect. Aaron, Cody, thank you so much for being able to dive into what Beeline and Zurv are able to provide for so many venues and organizations here as we start looking at, bringing players, staff, and team personnel back into our venues. And then, of course, ultimately getting to a point where we can have fans and somewhat of this, post-COVID world come into play here. So appreciate your time and being able to showcase how this all integrates within our GSA network. Next up, we have Juan Palacios, a postdoctoral associate at the MIT Sustainable Urbanization Lab, to showcase his research that he conducted on the component to encourage people to come back together in large events and large gathering spaces. Juan, really excited to hear more about your research, and the floor is yours.
Yeah, thank you, Garrett, and thank you so much to the organizers for inviting me. I'm very excited to join the conversation. And here, what this presentation tries to do is not so much to provide final answers, but try to walk the audience through the toolbox that we usually use to find what the real answer is, and in terms of what really matters for people when it comes to go back to the streets after a lockdown. The experiment took place in China just after a 2-month lockdown in a city. So we were able to, next slide. Thank you. We were able to work with a local government of a city of 10 million inhabitants to understand the behavior of people just after a lockdown, something that never experience for most of our people of the people in our sample. And with the problem of being the first wave, the first time the COVID hit a country, so you don't even understand what happens, what will happen in terms of the risk of the second wave and so forth. So what we did was getting 600 of the citizens to report everything they will do for 5 to 6 weeks after the city reopens. And also to give us access to their mobile phones so we could actually see where they are every other second over the entire 6 weeks after the city reopened. Gareth, can you go ahead? Thank you. And the key, what we did there is that the main thing that we managed to do with our partner, the local government, was to bring the experimental mindset in the way that there were so many solutions, so many technologies and so forth that were available back then, that we really needed to know how people will interact with such technologies or such surveys like we saw with Katrina, Aaron, Colin, what was really mattering, how we can really involve the people and bring people into the equation to bring them back safely into the streets. So the main thing of the experiment was just the core question was the understanding how people will interact with others and how people will take the presence of others in a high risk and in a low risk setting in the decision to go back to the streets. So basically, we will like to know back then how people will take the presence of people in restaurants in their decision to go back to such places. Are they going to avoid them, as the epidemiologists would suggest, in a situation where the virus was still kicking around in China? Will actually feel that seeing people in the restaurant will be discouraging, or will actually play a role? The psychology literature over 20, 30 years that would say that we social animals would like to follow others and learn from others, and they would take the presence of others as a sign of situation going back to normal is safe, and they would follow it. For a city planner, that's key, and the same also for a stadium manager. If people will follow others, you will have this snowball effect, where if you will bring a decent cohort to the stadium, then everybody will understand that is the moment to go back and follow them. While if you have this avoidance behavior situation, you will have this even opposite effect, that if you will bring certain cohorts, you will crowd out others. But the key is not really the question, but mainly the method. So in here, a little bit what Katrina was already hinting at, we took a proactive approach to this, and we basically mimic the approach that you are seeing now in the news on how people are testing vaccinations and different solutions to cope with either the infection or the symptoms of COVID. So we didn't wait, we didn't put this information out there and waited for the people to come to the information, but we actively put the information in people's phone over this period. So we didn't really wait for them to figure out. We actually waited, we put this information for them available to make sure that they had this information, and while we were monitoring their behavior. We didn't do it in all of them because we needed a comparison group. So we basically toasted a coin and said who will get information and compared it with those that were unlikely not to get information. So in the same way that you will see now in the vaccination discussion, that you have a lab and you put like 20 people getting the vaccine and 20 people not getting the vaccine. Our vaccine is information. So we did it in this experimental way to get to know what type of information matters for people when it comes to get back in the streets. Next slide. Thank you. And we did it week after week. And week after week, we worked with a survey agency to collect the plans for the weekend of 1,000 neighbors around our participants. And what we did was just follow all of our participants from Friday to Sunday to see what they were doing, whether we were going back to restaurants, to parks, and to all sort of public spaces in the city. And the only difference between the 300 people that were in our treatment group is that they got on Friday, just before the weekend, the percentage of neighbors that were planning to visit those parks or those restaurants over the weekend. The rest of it was exactly the same. We will monitor 300 people just following their normal life, and we will compare with these 300 people that got this piece of information. Next slide, please. And what did we find is that actually people took that as a strong sign that it was safe to go back to the streets. So when people will learn that their neighbors are back going to the restaurant or going back to the park, especially to the restaurant, to a high risk setting, they will follow them. And the key is also not to know that the average individual in our sample follows, but also to understand what are the barriers to such reactions. What makes someone to take that information as something encouraging, and what are the barriers that take this information as something discouraging. So for that, we collected a lot of information about them, and what we find is that the risk is an important factor, the risk perception. So the people that were really perceived the situation have been very risky were the ones that would not actually take this as an encouraging sign to change their behavior. And the people that in general are less willing to take risks, they were also not going to follow this information and follow others when it comes to joining back the streets. Also, education played a big role. So the people that were low educated were less likely to follow others when they would learn that they are back in the street. And that kind of correlates quite nicely with their behavior during the entire pandemic. So they were also less keen on finding information and less keen on understanding what COVID really was. So they were quite confused at the beginning of at the end of the lockdown, as you could find everywhere in the world that there are high discrepancies between people in terms of COVID knowledge. So all of these things makes that you could really see how your information is perceived by the average individual, but also how different cohorts and different groups of individuals with different characteristics will react in a completely different way. So here, only the individual with certain risk tolerance and the highly educated individuals were actually following us. So what we did in the next slide is to manipulate the risk for people. So we work with a certification agency of restaurants, well, basically an online portal in China that is providing information about restaurants all over the country. And we collected all information that we could about the restaurants in the nearby the participants of our study. And we built another vaccine for our participants that we gave to another 300 random participants, where we informed them about the precautionary measures that the restaurants were taking around them. The restaurants were doing temperature checks, they were increasing disinfection, they were ensuring that there is safe distancing across tables. So all of these things were put into a message together with our psychology team to bring the risk perception of people down and hopefully bring them back in the street. So that's what we found, that the risk perception went down, and they increased the likelihood of dying out. And they also chose these restaurants that were increasing their disinfection and these precautionary measures. So there is a way that you can, from the business side, ensure that people feel safe using such messaging to make sure that people risk perception is lower and they come back to the stadium. Next slide, please, Gary. There is one thing that is also very important to understand the people is that the same type of information, so just the amount of neighbors that are going up out in the streets, was taken a completely different way by different groups. So we discussed now about the risk, but there is also a big challenge when it comes to how people behave, who you attract when it comes to bring back to the stadium. So we had a big group of people that we call it less altruistic, the people that will have a less of a community feeling, and they will do less for others just without expecting anything to change, that were attracted in a wrong way. So when they actually learned that less people than expected were going to parks, they actually reacted, or restaurants, they were actually reacting by going themselves more. And these are the people that, instead of holding on, they went more to the restaurants. They were also the people that were less likely to wear face masks, to maintain safe distance, temperature checks, and all of the things that will make that a group of people will feel safer if everybody does their part. So what we did, next slide, was working with our psychology team to create an information message to make salient how they are supposed to behave when they are in the stadium, or when they are in the restaurant, sorry. So there are three basic tips that we usually follow. That is created by the MIT Human Cooperation Lab here, where we actually communicated very clearly how they are supposed to behave when they're in the street. So we communicated very clearly the impact not only for them but for the community. We make it categorical, and we make the clear expectation that all expect them to behave like this. So when we did this, these people actually behave according to the norm, and they actually reduce their visitations to restaurants, behaving in line with the rest of the community. Next slide. And so just to wrap up, there are two things that are important was important for us to achieve our goal. One of it is really taking an experimental approach, really giving the vaccine or giving our information to a random set of people, and really being proactive giving that information and not waiting them to get such information. And then the second one is to work with the psychologists to understand how to communicate clearly, and how to communicate clearly not only the impacts for them, but for the people in the community, to make sure that people not only come back to the restaurants in our case, or to the stadiums in your case, but they do it safely. Next slide. So with that, I just want to wrap up and thank you all. And I think that also one of the things that is important before I hand up to Garrett is that now is also the moment where there is a lot of unknowns, and there is a lot of opportunity for researchers to work with practitioners and figure out together all of these questions and have good outcomes for both sides. Thank you. Good.
Juan, thank you so much for that. Appreciate your expertise here and in-depth research on this interesting concept of bringing, our venues back open for team personnel, staff, and for fans, especially on how folks react to information and how we can also avoid these unintended consequences. Last but not least, I want to welcome Mike Donnert from the New York Mets, their Senior Director of Ballpark Operations, up for the last piece of this presentation. Mike, just would love to chat a little bit on the current operations over at Citi Field, what you guys have planned at present with Major League Baseball back up and running in a closed capacity, and then potentially, what you guys are looking at coming down the pipeline.
Sure. First off, good morning, afternoon to everybody. Thanks for calling in today and joining us. And also, more importantly, I hope everyone and their families are safe these days. And yeah, as Scott was saying, I kind of want to tie everything together from a facility standpoint, and probably more from the approach of everyone else joining in today, where there's all this great information that we just saw and read, and kind of how do we use that in our facilities and arenas and stadiums. Just a little bit of a setup with Citi Field, to use Katrina's example, where we would be considered phase one right now. We're obviously in the middle of our baseball season. Our full-time staff has not been allowed back in the ballpark yet. There's some support staff for games and stuff like that, but we're very limited on who's in the ballpark today. And from a facility manager standpoint, for me, it's the three key things for me is information, communication, and most importantly, safety. From an information standpoint, it's making sure that we're adhering to all the guidelines. So also another setup, anything player facing, clubhouses, dugouts, pretty much half our tunnel level is under the MLB guidelines, which in certain cases are even stricter than our state guidelines. Anything that's kind of back of house, office staff related, we're following the state guidelines at a minimum. We're doing above and beyond in some cases, but we're making sure that at a minimum we're adhering to all the guidelines from MLB standpoint and a New York State standpoint. And a large portion of the guidelines is getting out the information requirements, what our mask policies are, social distancing reminders. From the MLB standpoint, like I said, when players come into the building, a large portion of our tunnel goes into lockdown mode, and MLB has set up tiered access, so only tier 1 and 2 are allowed in certain areas, and tier 3 are not. And the challenges that brings upon us is that it's not just baseball games. We're also open to the players that might be rehabbing from an injury, or players that want to come in and work out during a road trip. So there's really, and that's not really anything that gets communicated to us days in advance. It's usually the night before, and we have to be able to kind of pivot within a couple hours and lock down certain areas. So from a staffing standpoint, when there's people that want to come in and do work around the ballpark on an off day, if there's a player coming in, we have to be able to communicate in real time saying these certain areas are on lockdown today. Things like where, our hand sanitizer stations, where are those located? We're going to be operating in a reduced capacity for quite some time, making sure that we're putting out what those capacities are. Elevators are running at, some are only running to certain floors. Staircases are being used in one direction only. So it's, how do we get all that information out there? And for me, the communication side is really the most important part right now, where it's how do we prevent a lot of this from becoming noise? If a lot of you think about where you work or venues you've been to, if you're able to go back into the restaurants and stores and stuff like that in your hometowns, how much of their signage do you actually see when you're walking in? For us, there's a lot of requirements on entry points and high traffic areas and stuff like that, and having postings up there. But there's also additional requirements, posting about labor laws. And if you think about a lot of our break rooms and pantry areas, there's a lot of postings up there. So we're technically meeting the requirements in terms of posting, but how effective are we actually being at people being able to digest that information? We're getting to the point, today where it's giving people access to the information isn't enough. We have to make sure that we're getting the information out there. And I can't stress enough how it has to be out there in real time. We're operating in a very fluid environment these days. Just from the state guidelines, those have been changing. It seems like almost weekly at this point. So if you might catch information the first day you're walking in, but once you walk into your office or building the second day, you're paying less attention to the signage that's up there. And how do we communicate that has changed over time? And kind of like I said earlier, we're kind of like in the phase one part right now, where we're kind of planning just for the players and some of the staff, but how much of what we're doing now is going to be scalable if we're looking at, I'm not sure when fans will be allowed back in the ballpark, but at what level is it going to be? 1,000 fans, 5,000, 10,000? So we're really trying to use this time right now to see what's working, what needs tweaking, what needs improvement. It just, mentioning scalability right now, just for our staff, our entry procedure, it's about a 45-second process for each person that comes in. We have, one person taking temperature readings, and there's, I forget how many questions offhand, but there's a health questionnaire that everyone has to answer. So things like that. How are we able to bring in, technology to really kind of remove the human element out of this? Also, obviously it has to be reliable, but it's just a lot of manual time that, especially since it's so repetitive, it's probably avoidable at this point where we're at with technology and people having mobile devices on them pretty much at all times. So that also kind of leads into kind of the solutions that Aaron and Cody were talking about. When you start getting into the contact tracing, it's unfortunate to see how rapidly this crippled the Marlins and the Cardinals. And we really have to be conscious of that, and not just from a player side, but making sure any person or any vendor that comes in, we're able to stop any potential outbreak as soon as we can. And once you kind of have a positive test, or if you want to get down to someone just showing symptoms, we have to be able to react immediately. And if you think about a manual process where if it's someone maintaining a database and relying on employees to kind of self-report where they've been, how much time is that going to take you to compile? Again, if God forbid there's a positive case in your facility, so that's where the technology and kind of having that ability to get that information out there ASAP that's going to be extremely vital for any of us to kind of navigate this effectively and efficiently. And also just quickly to touch on the survey component of this, that's another important thing where it's, again, this is going to be ever evolving. And no matter how great we are at our jobs from a facility manager standpoint, there's always going to be room for improvement. We're not really ever going to be able to account for the human element in our planning. So we can lay out everything perfectly, but once people start coming into our facility, and that's when we're really going to see how effective we were. And there'll only be tweaks here and there, but also from a staffing standpoint, I feel it's really more important from the psychological point of it, where it's letting your employees know that they're being heard and making them, make sure that they feel safe going back to the ballpark. Well, the ballpark in our case, but the anyone returning back to work and the offices, it's a very challenging time right now, and a lot of people aren't going to feel safe going back for the first time. So, as soon as they get there, if they see that management and building owners and operators are concerned about their opinions, and they see that they're being heard, hopefully that kind of speeds the process up along about them feeling safe and kind of putting aside all those fears that they might have come back early on. So hopefully that was somewhat enlightening and helpful to people, but I'll turn it over to Garrett now for I think we'll jump into some Q&A.
Thanks for that, Mike. Really appreciate it. I mean, the perspective that you guys have up in New York is really interesting, especially with, so many of our members are starting to open up. Some of them are still in the bubble format with MLS wrapping back up. They're going to be jumping into their home markets here pretty soon. And I know have been trying to take a lot of their practices from Orlando, seeing where they can implement that. And like you said, following state and local guidelines, while also looking towards the leagues and your other colleagues across the space of, how are you guys managing the communication side of things, and how are we able to just be as proactive and safe through this process as best we can, I think is going to be important here. Jumping right into Q&A, I want to welcome back Katrina, Juan, Aaron, and Cody back up onto video if possible. And for folks that haven't submitted any questions so far, feel free to let us know what you guys have for our speakers. Maybe just for the first one, I've got actually a quick couple of questions for each speaker, but maybe I'll jump into the first one for Katrina. The one that I've got here, it's specific to the iterative feedback loop that you had mentioned, of being able to go from surveying to improving, back to surveying and improving, and kind of having what Mike was mentioning as this ongoing process of being able to continue improving your operations and how you're able to communicate with your staff, team personnel, and fans of what you're doing. From your perspective, and also from the perspective of the playbook too, and the working group, what do you think is the best way to analyze these fan expectations and these staff expectations to then reflect on how you implement new policies and mandates within the venue? Do you have any thoughts on what some of those best practices or kind of, best methods could look like?
Yeah, definitely. It's a great question, because I think this kind of goes back to what Mike said about if you ask the question, when people answer, they expect to be heard, and that's really important. And so I think anytime that you do a survey and receive feedback and make changes, it's really important to say, based on your feedback, we heard you, we understand these obstacles, this is what we're doing to improve. And so it's really about communication and letting people know that this feedback is helpful, and then how it's being used. And citing specific examples, I think, can be really helpful as well.
No, that's awesome, Katrina. For Aaron and Cody, both of you can jump in here, certainly from the Beeline and Zerv perspective. But on that note, you guys, we're looking, and you had actually mentioned that, user participation needs to be at 100%. Otherwise, the efficacy of, what we're all trying to do here is really just to the extent of, it's in the hands of the people and kind of the ebb and flow of the situation right now. So with the product and service that you guys have in front of you, how would you kind of look at this user participation side of being able to say, okay, here's this level of user adoption that we have across our platform, and here's this level of kind of efficacy that comes with that, what would you see as kind of that, you know, how am I trying to say this? Kind of this benchmark phase of here's the number and here's the area that we need to be at for all of these policies and practices to be efficient for the sake of our team members and staff here.
Cody, do you want to start with that?
Cody, maybe
I don't know if I can
mute for us.
You're on mute, Cody. How do we, in terms of the efficacy, I think obviously what we're trying to do is we're trying to contain the spread as much as possible. So if there is a COVID positive individual, like on the Marlins, one individual getting sick and then 20 getting sick very shortly thereafter, and then having, you know, over $100 million sitting on the bench. This is a huge, there's a huge problem here in terms of like just productivity. And we hear this from a lot of our clients, whether they're lawyers or accountants. It's like, I can't lose 50% of my staff because of COVID. And so, you know, making people feel safe, just doing normal things and getting back to a new normal is, we're just trying to provide a platform that is kind of like a life jacket. We like to use the analogy of like getting on a ship. You know, you like to get on a ship, but if you don't have a life jacket, if the ship sinks, you're in trouble. We really just like to kind of provide that mechanism that if something does happen, that you can respond as quickly as possible and alert people as quickly as possible to prevent that from, you know, them going to a sporting event and getting on transit with someone, and then bringing that back to their office. And then, you know, again, we just want to prevent a lockdown again as much as possible, because we really need to, you know, keep the economy open and get people moving again in order to just you know, not only people's, you know, physical health, but also their mental health as well. Cody, anything you want to add to that?
Yeah, absolutely. And to tether that to Michael, what you were saying a little bit earlier regarding processes, right? We can put processes in place that we hope get followed, but the more we automate these processes, the more consistent they will become. So Garrett, if I'm understanding your question, it's what is how much people need to adopt the Beeline platform for the data to be consistent across and really prevent a future outbreak and really keep people at work, on the field, in the game and play. And the answer is 100%. So the reason we've tethered our platforms together is because when you provide a catalyst like, hey, you have to download Zerv now to get into the office, or excuse me, you have to download Beeline that has the power of Zerv to get into the office. Therefore, it's a mandate of like, okay, and you can tether a messaging around that as well. Well, by downloading Beeline, now you have touchless access. You don't have to touch anything. So we're removing touch points. We have your health in mind. We have you focused, because what we're dealing with in this pandemic is people's lives, right? So people are afraid because they like living. They don't want to get sick because of the fear of what the virus will do to them. So through automating processes, through getting user adoption, and however you want to spin that, we see the value and our customers see the value in packaging this together, because it's truly and I know I've said catalyst a million times at this point, it's the catalyst to getting to people download the app. If you have to have the Beeline app to open the gate to get you into the game, okay, you're going to download the Beeline app. All of a sudden you have 100% adoption.
Absolutely. Appreciate that, Aaron and Cody, and kind of this depiction of, you know, here's the situation in front of us and here's what we need to really be efficient in our methods and how we can make everybody have that sense of security and safety that Mike mentioned at the end of his piece. Juan, there was a question that came in that was, I thought, really interesting on something that you touched on a little bit, but not necessarily in too much in depth on. You talked about the behavior of folks, at least in the study that you did, really being affected by looking at the actions and behaviors of others around them. And I think that's certainly applicable to the sports industry and the fans and folks that are a part of our network here, that, you know, we are a very conglomerate group and tend to have certain areas of group thought here and there, depending on the region and the fans. This question was asking, you know, to avoid these unintended consequences, did you and the team look at efficient methods of signage and what resulted in maybe a lower percentage of unintended consequences within your study?
Yeah, so yeah, that's a great question. Thank you, Gary, for sending it around. Yes, so we what we did was working very closely with the psychologists to really chip in this sense of community that I think that is very applicable for the baseball industry or our attendees of the seminars, where when people really feel that they are harming their community and they are behaving against what the norm is saying within the community, that is super strong for them to behave in the social optimum. So if you are just going out and then just get this behavior of people in a very raw, just basically knowing how many people are going back to the stadium, for example, you can interpret it in multiple ways. It is nothing normative or categorical for you to understand how you are expected to behave once you are there. But once you really work with the psychologist to make salient how the rest of the community is behaving to protect others, then you understand what you should do. So when there are some people that have it by default, so that's what we see, like the average guy in our sample will just learn that when they go out in this situation, they will have to wear face mask, avoid being too close to others, and so forth. There are some people that you still don't have those things so clear, and as Aaron and colleagues were saying, like you need 100% of people adopting their technology, but you also need, I don't know whether 100%, but even 2% of people not behaving in a pro-social way can make the harm for a lot of others. So you need to make sure that that percentage of people not behaving accordingly goes down to zero as much as you can.
Thanks for that, Juan. And for everybody on the call, thank you so much for joining us today. I know we've got just a couple more minutes before the end of the hour that we've got allotted here, but we've got one final question that I would love for Mike to start out with, and then we can circulate it around for the rest of the team for their final thoughts on that question as well. I mean, of course, the Green Sports Alliance here, we're looking at building out the sports greening movement across all of our membership, from professional sports teams, colleges, to other smaller venues and the like. Within this phase 1 to phase 2, 3 approach, what do you guys think, at least from the perspective of Citi Field and the Mets, needs to be kind of the key pieces that we focus on as we reopen our venues in order to continue pushing the sustainability efforts that you guys have done for, greatly for so long in a positive manner, rather than putting that on the back burner? Any thoughts there, Mike?
No, it's definitely a challenge for us right now, even just dealing with it on a small scale. One of the big things we're dealing with right now is, just good example is just trash sorting. In the past, we have a one-to-one setup on our concourses and throughout the offices and stuff like that. And if staff was going through before, if they saw recyclable in the trash, they wouldn't hesitate to put that in the recycling bin and kind of help out that way. But now, it's I guess it's just trying to find that kind of that safety sweet spot. And right now, staff is a little afraid to touch too many things, so they're comfortable going in and grabbing the bag out of the receptacle. They're not too comfortable going in and fishing around garbage and pulling out recyclables. So even though they might notice that there's a potential contamination issue, right now they're just not comfortable going in and correcting that. And it's not something we're trying to force right now, as much as sustainability and everything is a major focus for us. Obviously the health and safety of everyone kind of comes first right now, and we're trying to navigate all those issues where it's how do we kind of manage all these different variables and just everything today, where it's just so, can't really even say, like, upside down these days. It's just an insane time that we're just trying to navigate. And fortunately for us, it's still a small scale issue, but it's definitely a topic we're trying to figure out, how do we manage this when we start ramping up a little bit again to a larger scale issue.
Thanks for that, Mike. Katrina, any final thoughts on your end as we close out the webinar here today?
Yeah, I think particularly for sustainability, it just needs to be part of the planning process. I don't think it's the binary yes or no. I think similar to how most stadiums right now integrate sustainability in their everyday operations, it just needs to be considered part of the planning process, as well as thinking about different ways of doing things. For example, rather than printing signs and posting them, which is a logistical, financial, and environmental obstacle, consider how you can really leverage your digital signage or investing in a media solution with TVs throughout your screen, looking at other options that bring information to people's phones rather than having them look in different locations. So look at what's out there and always consider sustainability in your solution process, because I don't think it has to be a yes or no. I think it can be part of the solution.
Completely agree, Katrina. Aaron and Cody, any lasting impressions you wanted to leave with the audience here today?
Yeah, I just think that sustainability, especially from a mobility perspective, can really be augmented with COVID. If you have people who are afraid to take transit or are biking to games, and we have data of where people are biking from and how many bike racks they need, really kind of leaning into that and providing those facilities so that this is something that could be not just something during COVID right now, but also something that would continue afterwards. And you can use that infrastructure and that will to be like, hey, it's much safer and easier to get to games, and I can park right next to the stadium and not have to worry. So, especially with the data we can get from smartphones now, just getting to and from and within the building, there's like having data that we've never had before can just elevate the conversation around sustainability and just create better design, not just for, our clients, but also within the cities in which they exist as well, right?
I would probably just add to that as well, as that data can be leveraged to really lower the impact of the building on the environment, because now through automation, you can find out how many people are where, when, for how long, and use that to turn off lights, recirculate airflow. You can do a lot of things that have taken a back burner in the Beeline Zerv solution, because right now we're focusing on more just capacity monitoring. But later down the line, when we do get in front of this and we start having wins over COVID, all of that can come back in. And then me biasly, stop printing those access badges. They're made of plastic. They're terrible.
You got it. Thanks, you two. Juan, any lasting impressions from you?
Sure. I would say that not only the technology and the data we're collecting, but also the learning that we're going through the COVID is also going to be very helpful for the sustainability goals that we have in front. Because one of the things that we are learning is that with the COVID is that the stakes of not behaving in a good way has big consequences for others. And a lot of the sustainability goals and a lot of the sustainability initiatives try to chip in that kind of mentality to avoid overuse of resources or overuse of taking advantage of other people. So I think that what we are going to learn in the next months in how to work with people to make them behave in a good way for the COVID issue can be also having a lot of learning outcomes for our sustainability goals in the future.
Absolutely, couldn't agree more. Well, everyone, thank you so much for joining us today. Huge thank you, of course, to all of our speakers for sharing your expertise on today's webinar, and really just for propelling the sports greening movement forward. I want to thank everybody for tuning in on our attendee side, and hope everyone is staying safe and healthy, and looking forward to our next discussion here on September 2nd. Looking forward to continuing this ready to play format here for the sake of our members and our partners. So thanks, everyone. Have a great rest of your day.
Thanks so much.
Bye.
Thanks, everyone.